How long have you been working for the ambulance service, and what is it you do?
I've been working for the ambulance service 17 years, and currently I am a clinical audit analyst, which means I am a registered paramedic, but due to an injury I can't work frontline, so I can't work actually on the ambulances out in public. So I work behind the scenes, so I audit other paramedics to make sure that they're doing their job correctly. So make sure that they're keeping to national guidelines and using the programming software that we use to triage calls coming through the 999 call centre correctly.
And make sure that like people get the correct help and like.
Yes, yeah. So make sure that the correct training is delivered. Make sure everyone's up to speed and that they understand how to use the training software and how to use the triage system.
I imagine that must be hard for if you have like new trainees coming in.
Yeah, it's very hard. So a lot of the trainees we have that first point of contact, people that call 999 and speak to a call handler. Obviously, call handlers aren't medically trained, so we have to give them an understanding of medical issues to better help and serve the public. So it's a short training course with a lot of information, so a lot of people struggle to pass the course. There's a lot of information that we...
To process at once?
Yeah, it's a lot of information that we give them in a short space of time.
Do you think that the fact that they're not fully medically trained like adds to the stress of your work and to the other auditors?
Yes, definitely. Definitely.
Do you think they should be fully trained before they get moved on to, or at least have a more basic understanding themselves before they get moved on to the call centre?
I think it would help, definitely. It definitely would help, especially for more of the complex calls that come through, especially the 999 system. Obviously the 111 system is a sort of catch-all for your sneezes and your itches and your rashes. But obviously 999, people tend to call that when they're having the chest pains and the heart attacks and what have you, and the more serious things. So yes, having people that have a better understanding or some medical knowledge prior to coming into the centre would be invaluable.
Helps lessen the risk of misdiagnosing some of the...
Well, we don't. That's the thing. It's not a case of diagnosing people over the phone on their first port of call. It is to try and rule out
what could be wrong.
What could be wrong, exactly. So if we get to the point where we can't rule something out, that's when we will escalate it to either an ambulance is sent for a face-to-face consult, or it will get passed over to the clinical hub, where somebody like myself would call the patient back to gain further information.
Do you feel that like the 111 calls tend to like overlap and overshadow the 999 calls and like possibly hinder people who seriously need help, as opposed to like someone who has a really bad cough?
We tend to get a lot of 111 calls being passed through to the 999 call centre. Again, a lot of that is down to
lack of training.
Lack of training or poor understanding of how the system works.
So you think more training should be done to like for people who work for 111 calls, so they don't...
Not just 111, 999 also. I believe if it wasn't such a rush to get people through and trained, because there is such a short staff in both sides 111 and 999. If there wasn't such a rush to get people trained and answering phone calls, if they were given the time to be able to digest and process the information that we're giving them, then the public would be better served, personally.
Do you think, like, what are the kind of day-to-day stresses that occur from like the 999 calls, the 111 calls, and the undertrained staff?
Well, yeah. From my point of view, what stresses me is, like I say, I obviously audit the calls, so I have to make sure that the people are taking the calls properly. So I have to listen back and listen to the calls to audit them. And what I find stressful, especially people that I've trained, and I know that I haven't trained them to do X, Y, Z, and they're doing it, and then I'm having to pull them up and retrain them, and it's stressful to know that I didn't train them to do that, but for whatever reason, unbeknown to me, that they've picked up bad habits, and or they're missing things that are, to me, blatantly obvious, but I could just be being a little bit harsh being a paramedic, so you should know what that is.
Yeah.
But obviously somebody that's not medically trained, then I suppose in a way that they wouldn't.
Yeah. Is it hard to listen back to some of the calls that you have to obviously audit for? Right.
The standard. Obviously, we have to do just a slice of calls across the board, just as a regular audit to make sure everyone's on track. But obviously, occasionally there's serious incidents occur, unfortunately. So when something serious has happened or a complaint has come in, then we have to listen to the call to audit to be part of the investigation. And those are always hard to listen back to, because you can guarantee that if we're having to audit because of an investigation, that it's usually because something
Really bad has happened.
nasty has happened. Yeah.
Is it hard to deal with that sometimes?
It's always hard to deal with those ones, because as I said before, we know how the software should be used, we know what should be done, especially from my point of view being a paramedic. I know what should have been done, what I would have done, and it's hard knowing that one, I wasn't there, so I couldn't do anything, and you end up sort of screaming at a tape. Because you can hear things being said, and you're just like, why are you saying that? Why are you doing that? Stop! But you can't. It's like a horror film that you're having to listen to, but you know it's real life. Does that make sense?
Yeah. Obviously, it's difficult, as you said. And does the NHS offer you any help to deal with those situations, or anything similar that causes you?
For my job, absolutely nothing whatsoever do they offer us in any way, shape or form to deal with stress.
Nothing at all?
Nothing at all. There is nationally across the ambulance service, through our sick line, a national number that we can ring if we feel that we are suffering with stress, to call, to contact.
So you'd say that doesn't help
I'm
at
not
all?
aware of anybody that's actually called that number, but we tend to be in the in headquarters, in control. We tend to get we basically, well, we do not tend to, we get forgotten. Obviously the frontline staff get remembered if they go to a particularly unpleasant job or a hard job. They'll make sure that they're debriefed, that there's
counselling, for example.
Yeah, there's counselling put in place for them. For the call taker that took the call at the time, the dispatch that dispatched on the call at the time will get counselling offered counselling if they want it, if they need it. They'll get taken out for a cup of coffee or a walk around the block or something like that. But us as auditors that have to listen to that tape and listen and deal with that, and over and over and over again, one investigation, you could potentially end up listening to the same call for your whole 10-hour shift over and over again, just to get every piece of information you need for the coroner or for the police or just an internal investigation. And they don't seem to remember us at all. We tend to get forgotten about completely.
Would you say it's because, as you said earlier, you're behind the lines and behind the scenes?
I think so, yeah, because we're behind the scenes, and they think, it won't affect them. It doesn't affect them. It's old stuff to the call taker, it's old stuff to the dispatcher or the crew, they're now having to write statements or whatever the reason is, the call's been brought back up again. But for us as auditors, for us as the new investigation party, it's new to us, it's the first time we've listened to it, and the call taker will have yes, okay, it's happening to them straight away in their call, but they just listen to it once, that's it. We've got to listen to it over and over again, so we're listening to the screams or the panic or the things that are going wrong, and we're having to listen to that and dissect it and play it back over and over and over again. So it's, as I said, it's like a horror film that you can't escape from, you just have to keep watching or listening to it over and over again.
Would you say, like, it's especially worse since they'll, in the moment, the call taker and the dispatcher and obviously the road staff can deal with it in the moment, and if they know what to do they can help and stop it, but whereas you as an auditor, it's already happened, and so you have to just listen. You can't change anything that happened as it's in the past.
Yeah, exactly. We just have to listen to. I've known fellow colleagues, fellow auditors, sit there crying whilst they're doing their audit, because it's that harrowing, that it's in that emotional that they're just sitting there, they're crying. It's, I don't know what else to say, really.
Like, obviously, because it's so stressful and so traumatic, like, and as you said, the NHS doesn't offer the auditors any help, like, or if they do, it's not made aware, consciously,
Yeah.
that there is help. What do you yourself do to help try and relieve some of that stress and, like, as you said, the horrific imagery and that you imagine, and as well as other auditors, like?
Yeah, well, the team of auditors that I work with, there isn't many. There is literally a handful of us. There is not many of us at all. So obviously we are extremely close because of the type of job that we do, and the fact that not many people understand it and what's really involved in it. I think they think a lot of the time that we just sit with our feet on the desk drinking cups of tea and eating biscuits and
Looking bossy.
and being horrible and picking on them because
Yeah.
we've marked them down here and there, and they're now having to do reflective practice and
Like an annoying teacher.
yeah, we've given them we've given them a D rather than a big gold shiny star.
Yeah.
So we tend to be we're the baddies, so we're not liked by the staff in the control centre because with the meanies, so we tend to have to stick together.
Would you say that makes it worse?
It does make it more stressful. It's an added dimension to the stress of everything, because obviously, especially if an investigation comes around and we're having to,
And someone's in the wrong, for example, and
something's happened, so we have to mark them down and highlight that a training need or an error has occurred, and obviously statements are going round. So the call takers having to relive it again because they're having to make statements, and then we're having to question why they did it or bring them in for retraining or whatever. So so we're always the bad ones. We're always the scapegoat. We're always blamed. It's always our fault.
does it add tension in the call centre? Like, obviously, where you have to analyse, like, different staff members' calls and what they've said and what they've done, whether they've followed the guidelines and that. Does it cause, like, not unnecessary tension, but just tension overall?
Yeah, oh definitely. I've known colleagues that have actively avoided going into the control room because they know certain members of staff are on, because they don't want the stress of potential confrontation.
Do you not think that the NHS, the higher management, or whoever is in charge of auditing and call centres, do you not think that they should do more, put more effort into making sure that the tensions in the call centre, like, because obviously it's not all of the auditors' fault, most of the time, and
Yeah. Unfortunately, we're so short-staffed all over. The majority of the higher echelons, the higher management, are so focused on meeting government targets and making sure that ambulances are there to meet the patients, that the background stuff gets put on a back burner and gets to a certain point forgotten about. Every now and again we'll sort of kick up a fuss and make our voices heard, and then
Send some help.
they'll promise to do something, but nothing really ever.
So you'd say they
promises.
make a lot of empty promises and...
Oh, definitely, all the time.
Obviously, it must take a while to do your job. Like, do you get enough time for your breaks to... Say, for example, you've had to audit a really stressful call. Do you get enough time on your break to just sit down and recuperate yourself and relax for like 5 minutes?
Not really, because there's so many other added stress. It's not just that I don't go in at the beginning of my shift and just sit at the computer and audit calls. I've got obviously old audits where if people have got issues or have taken umbrage over something that I've done, they'll want it explained or they'll question it, or if there's peer reviews that need to be done, so I need to go and speak to a member of staff and come up with an action plan to help them study to help them gain additional knowledge if there's an area that they're lacking in. If they need remedial training or something like that, or if our REAP level goes up, especially this time of year, where it's we're DEFCON 5 at the moment, I think.
Could you explain what a REAP level is?
REAP level, oh now you're asking. It's an acronym for an escalation of, I can't remember what the initials mean, I'm sorry. But basically, the more stress that the ambulance service is under, the higher the number. So this time of year, the highest is 6. That normally means that basically the NHS has fallen over. Level 4 means that they cancel all training. Anyone that's clinically qualified that can man a telephone or an ambulance does so. So managers all meetings are cancelled. Managers are put out and answer calls. Overtime is thrown out like there's no tomorrow. If you can come in for 2 hours and you come in for 2 hours, they'll bite your hand off. They just throw everything and the kitchen sink at it, basically. So so obviously being a paramedic as well, so if where we are at the moment, so I could be quite happily, well, I say quite happily, but I could be doing my job as an auditor, and then I could be getting a call from upstairs saying you need to come upstairs, you need to man the phones, you need to be live on the desk.
So you definitely say that there's nowhere near enough time for everything that goes on. For like, say it's around Christmas time, the REAP levels must get ridiculous around Christmas time.
Yeah, the escalation, it goes through the contingency plans with business continuity all the time. So crews on the road are going without meal breaks. Obviously that's the knock-on effect. Obviously if the clinical crews on the road aren't getting breaks, then the clinical person on the desk answering the telephones, calling patients back, certainly aren't getting breaks.
With the large influx of calls that they must be getting.
You'd be lucky if there's 2 at each site in each county. So you have however many out of each station across the county. You've got 1, if you're lucky 2, clinical supervisors are calling back. So whereas a patient in the back of the vehicle is being looked after by the crew for however long that they're with that crew, as a clinical supervisor and you're calling back patients, you're having to call back patients, and considering consider and still dealing with the patient that you were speaking to earlier, whether that's because you're trying to get through to the doctor to call them back, or you're trying to escalate their care somewhere else, or trying to make sure that the ambulance that you've sent to see them is going to get there, as well as dealing with the person that you're now on the phone to, and considering the person that you need to be calling straight after that person. Whereas the crew on the road, they know that there's going to be more jobs in the ether. They're going to get another job once they've taken this patient to hospital, that patient to hospital. But they don't know. There's always that potential that they might get 5 minutes, whereas we know we're not going to get 5 minutes because we can just see the call after call after call coming in, and the screen is flashing at us.
Would you say that, as you said earlier, the 111 calls and that, does that make things even more ridiculously difficult, considering you could have really important calls around, for example, like New Year's? It must be incredibly busy.
It is, and it is also stressful knowing, in theory, because it is the same triage system that the 111 staff and 999 staff use. In theory, it's the same training. They should have the same knowledge. So it is stressful as to why one group of people can triage something
And
one
another
way
can't. Yeah.
and another group can't. And it's also stressful knowing that there are more clinicians in the 111 office, in the 111 call centre, that there's more clinically trained people in there to assist and help the call handlers than there is. As I said, there's only potentially me in a room of 30 call handlers. So you're trying to answer and guide 30 people answering phones. It's not humanly possible.
So you'd say that they should really relocate some of the clinical staff from the 111 centre to the 999 centre to deal with the more pressing and urgent, like,
No,
life or death calls.
Unfortunately, that won't work. It's like anything. It takes us. It's a difficult job. It's a difficult job, and I don't know what the answer is, because there's so many different variables coming in, and you could have, for example, we've had nurses in as clinicians that are fantastic nurses, but they just can't. They just haven't got the 999 mentality, for want of a better word. Whereas they'll be quite happy to discuss the patient's urine output and the colour of their toenails,
Yeah.
for example, but they're missing the fact that the patient's clutching their chest and turning blue.
They miss the vital
Yeah.
points, whereas they're obviously like sorely needed for.
So some clinicians tend to work from the easy stuff up to the more desperate stuff, whereas the ambulance service, we've always worked the other way around. We've always gone in there going, right, you potentially could die. You're not going to die, brilliant, and we'll work our way down to you've stubbed your toe, you're fine.
Yeah.
Whereas everyone else in the NHS works the other way round. They work from the stub toe upwards, and working in the clinic, in the EOC, working in the call centre, you need to be of that mentality. You need to be working of the, right, do we need to send an ambulance? No, okay, right, we can slow down and look a bit
Work
further.
through the stages.
Work through the stages, and it's hard for people that have never worked that way round
To get used to changing.
Yeah.
Old habits die hard, as they say.
Yeah.
But despite, like, hang on, let me try that again. In short, what improvements do you think could be made to the audit sector or the call centre or anything? Just
I don't know, is the honest answer. Obviously there's the usual answers is more staff, more money, more this, more that, but I don't know, is the honest answer. clinical supervisor job has been out for advert. They've tried tweaking it, tried changing the name of it. They've tried dangling the big juicy carrot to try and entice people to the job for the last 7 years, and people just aren't staying. It's too stressful. There's too much risk. I don't know what the answer is to get staff in.
Overall, do you actually enjoy working for the ambulance service?
After all that, yes, yeah, I do.
Like, despite everything?
Despite everything, I think the reason why I get so stressed and so angry at times with my job is because I care.
Because you're so passionate about it.
Exactly. I think if I didn't care as much, then I probably wouldn't be as stressed and get so worked up over things, because it's just a call, I've just got to fill a form in, there you go, next job, next audit. As I say, because I care about the job, I care about the staff and the patients, and yeah, so that's why I get so angry and so stressed by it all.
Thank you.